According to the American Heart Association, nearly half of all American adults, roughly 122 million people, have high blood pressure. Here's the part that should shock you. 75% of them are on medication to control it. Yet those medications aren't controlling the disease. Every year, more than 675,000 Americans die from hypertension-related complications, despite faithfully swallowing their pills each morning. What if everything you've been told about this condition is fundamentally incomplete? After more than 20 years practicing cardiac surgery, I can tell you exactly why these medications fail, because the framework we've been given is outdated. You've been taught that hypertension is a plumbing problem, too much fluid volume in your circulatory system. Your doctor tells you to cut salt, take a diuretic, flush out the excess water. The numbers on your blood pressure monitor drop, problem solved. Except the problem is absolutely not solved. This way of thinking is a medical approach from 50 years ago. It's incomplete, misleading, and keeping millions of people sick despite seemingly controlled readings. The reality is far more complex. Hypertension isn't a fluid volume problem, it's a problem with the pipes themselves. Your arteries aren't simply too full, they're damaged, deteriorating, rigid. They've undergone structural changes at the cellular level that no prescription drug can repair. When I open a patient's chest for a coronary bypass, I see this destruction immediately. A healthy artery has elasticity. It springs back when you make an incision. But a diseased artery in someone with chronic hypertension is like cutting into bone, rigid, calcified, inflexible. That rigidity is what hypertension truly is. And medications don't fix rigidity. They manipulate the number on your monitor without repairing the underlying structural damage. The 4 hidden mechanisms destroying your arteries. To understand what hypertension really is at the cellular level, you need to understand your arterial wall. Your arteries are extraordinarily complex living structures made up of 3 distinct layers. The innermost layer, in direct contact with your circulating blood, is called the endothelium. It's a single layer of cells, thinner than a piece of tissue paper, lining every blood vessel throughout your body. This layer is absolutely critical. It isn't just a physical barrier, it's an active metabolic organ that produces chemical signals controlling blood flow, preventing inappropriate clotting, regulating inflammation, and maintaining vascular health. The endothelium has its own protective coating, a microscopic layer called the glycocalyx. Think of it as a non-stick coating on the inner surface of your arteries. Built from sugar molecules and proteins, just a few micrometers thick and invisible to the naked eye, it is one of the most important structures in your cardiovascular system. Research published in Pfluger's archive in 2007 established that the glycocalyx serves several critical functions. It creates a smooth, frictionless surface, allowing blood to flow without resistance. It prevents inflammatory molecules from reaching and attaching to the vessel wall, and it detects changes in blood flow to signal the endothelium to release nitric oxide, a gas that keeps vessels relaxed and dilated. When your glycocalyx remains intact, your vessels stay flexible and functional. When it's damaged and breaks down, everything collapses. Chronic high blood sugar, systemic inflammation, smoking, and oxidative stress dissolve the glycocalyx like acid. Once it's gone, the vessel wall becomes exposed and vulnerable. Inflammatory molecules attach to the endothelium, white blood cells adhere to the wall, LDL cholesterol particles penetrate the vascular tissue, atherosclerotic plaques begin forming, and the endothelium stops producing enough nitric oxide. Your vessels contract and lose their flexibility. Blood pressure rises. This is the first mechanism: glycocalyx destruction and endothelial damage. Here's the critical point: no blood pressure medication acts on the glycocalyx. ACE inhibitors don't repair it. Beta blockers don't repair it. Calcium channel blockers don't repair it. Diuretics certainly don't. They manage the number on your monitor, but the underlying damage goes untreated. The second mechanism is arterial stiffness and calcification, one most physicians ignore entirely. They focus exclusively on blood pressure numbers without accounting for arterial rigidity or flexibility. Yet that distinction matters more than the numbers themselves. Research published in the Journal of the American College of Cardiology in 2010 demonstrated that arterial stiffness predicts cardiovascular events and all-cause mortality better than traditional blood pressure measurements. Your arterial middle layer, the tunica media, is made up of smooth muscle cells and elastic fibers, giving your arteries their flexibility. But with age, especially in the presence of hypertension, diabetes, or chronic inflammation, several destructive processes take hold. Calcium deposits begin to form, elastic fibers degrade, progressively replaced by rigid, inflexible collagen, and smooth muscle cells undergo a pathological transformation, ceasing to function as muscle cells and instead behaving like bone-forming cells, actively depositing calcium. A review published in the Journal of the American College of Cardiology in 2019 identified this process, vascular calcification, as the primary driver of arterial stiffness. No blood pressure medication reverses it. The third mechanism is nitric oxide deficiency. Nitric oxide is a gas produced by your endothelial cells. When the endothelium is damaged, production drops dramatically. Your vessels can no longer relax. They stay contracted, and blood pressure rises and remains elevated. The enzyme responsible for this production is called eNOS, and it's damaged by the very same factors that destroy the glycocalyx: high blood sugar, oxidative stress, and chronic inflammation. This enzyme requires a critical cofactor called tetrahydrobiopterin. When that cofactor is depleted, eNOS produces harmful free radicals instead of beneficial nitric oxide. The fourth mechanism is the insulin-kidney connection, and it explains why reducing salt doesn't work for most hypertensive people. Your kidneys control blood pressure by regulating sodium balance, but insulin blocks sodium excretion by the kidneys. When insulin levels are chronically elevated, your kidneys retain sodium regardless of how much salt you consume. Research published in the New England Journal of Medicine in 1987 established that insulin resistance is present in essential hypertension and plays a causal role in elevated blood pressure. What most people don't realize is that you can have significant insulin resistance without having diabetes. Your fasting blood sugar can be perfectly normal, yet your insulin levels may be substantially elevated, silently driving your hypertension. Most doctors never check insulin levels. They check blood sugar, assume it's fine if it's normal, and move on. That's a mistake. The four-step protocol to actually reverse these mechanisms. Step 1. Restore the glycocalyx. You must first stop destroying it. The primary culprits are high blood sugar and oxidative stress. Every time your blood sugar exceeds 8 mmol/L after a meal, it damages the glycocalyx through a process called glycation. The goal is to keep your post-meal blood sugar consistently below 7.8 mmol/L, which for most people means significantly reducing refined carbohydrates. Not eliminating all carbs, but choosing those that don't cause dramatic blood sugar spikes. Whole foods, non-starchy vegetables, legumes, certain fruits, while avoiding sugar, white bread, white rice, pasta, and processed baked goods. You also need to supply the materials your body requires to rebuild the glycocalyx, which is primarily constructed from molecules called glycosaminoglycans. The best dietary sources are sulfated polysaccharides from marine algae, specifically fucoidan from brown seaweed. Research has shown these compounds restore glycocalyx thickness and improve endothelial function. Supplements containing fucoidan are available. Studies demonstrating benefit-use doses of 600 to 1,000 milligrams per day. Finally, you need to substantially reduce oxidative stress. The most powerful antioxidants for vascular health are polyphenols from colorful vegetables and fruits, berries, leafy greens, beets, dark chocolate, and green tea. Step 2. Decalcify. Remove calcium from your arterial walls and restore flexibility. The key protein here is matrix GLA protein, or MGP. It acts as a traffic controller for calcium. When properly activated, it directs calcium to your bones where it belongs. When it isn't activated, calcium migrates into your arteries and deposits in the vascular walls. MGP is activated by vitamin K2, specifically the MK7 form. Research published in Atherosclerosis in 2009 established that high menaquinone intake is associated with reduced coronary calcification. The Rotterdam study, published in the Journal of Nutrition in 2004, confirmed that dietary intake of K2 is associated with reduced coronary artery disease risk. Studies showing benefit use doses of 180 to 360 micrograms per day of MK7. But K2 alone isn't enough. Calcium needs vitamin D to enter bone tissue effectively. Vitamin D increases calcium absorption in your digestive tract and helps incorporate it into the bone matrix. The two work together, and both are needed. The third component is magnesium, nature's natural calcium channel blocker. When magnesium levels are adequate, it prevents calcium from inappropriately entering the smooth muscle cells of vessel walls. When deficient, calcium floods those cells, vessels contract, and blood pressure rises. Most people are magnesium deficient. The solution is supplementation with highly absorbable forms, magnesium glycinate or magnesium threonate, at doses of 400 to 600 milligrams per day. Step 3. Restore nitric oxide. First, protect and support tetrahydrobiopterin, the critical cofactor for the ENOS enzyme, by ensuring adequate intake of folate, vitamin C, and vitamin E. These vitamins help regenerate this cofactor and prevent ENOS uncoupling. Folate comes from leafy greens, vitamin C from citrus, berries, and bell peppers, and vitamin E from nuts and seeds. Second, stimulate ENOS through mechanical shear stress. The most effective method is isometric hand grip training. Squeeze a grip device at 30% of your maximum strength for 2 minutes. Rest 1 minute, repeat 4 times. Do this 4 times per week. A meta-analysis published in Sports Medicine in 2014 demonstrated that isometric training reduces systolic blood pressure by 8 to 12 points after 8 weeks of regular practice. Third, practice nasal breathing. When you breathe through your nose rather than your mouth, your nasal passages produce nitric oxide, and studies have shown that nasal breathing increases blood nitric oxide levels by up to 400% compared to mouth breathing. Step 4. Reset insulin, which unlocks your kidneys and allows them to excrete sodium properly. Elevated insulin locks your kidneys into sodium retention mode. The most effective method for lowering insulin levels is time-restricted eating, condensing all food intake into a specific window each day, and fasting during the remaining hours. For hypertensive individuals, I recommend a 16-hour fast with an 8-hour eating window, consuming all meals between noon and 8 p.m., then fasting until noon the following day. During the fasting window, water, black coffee, and plain tea are permitted. Research shows this approach reduces systolic blood pressure by 9 to 11 points in 8 weeks, with no change in what you eat, only when you eat. The mechanism is purely insulin-related. Lower insulin means unlocked kidneys, which means appropriate sodium excretion, which means normalized blood pressure. You also need to reduce insulin resistance at the cellular level. The most effective method for improving insulin sensitivity is resistance training. When you perform resistance exercises, your muscles develop more insulin receptors. Studies show that resistance training 2 to 3 times per week lowers fasting insulin by 20 to 30% over 12 weeks. How to implement this protocol? Safely, one thing must be stated clearly. Do not abruptly stop your blood pressure medication. That would be dangerous. Medications manage symptoms while these protocols address root causes. You need both initially. Begin implementing these protocols while continuing your current medication. As your blood pressure improves over weeks and months, work collaboratively with your doctor to gradually reduce medication under medical supervision. Monitor your blood pressure daily at home, track the trends, and when your numbers improve consistently and remain stable, discuss tapering with your physician. Never stop a medication suddenly on your own. Never reduce doses without medical oversight. That said, don't accept the belief that you'll need medication for life. Conventional medicine knows how to manage blood pressure numbers temporarily. It doesn't know how to reverse vascular damage. But now you know something different. You understand the glycocalyx, arterial calcification, nitric oxide, and the insulin-kidney connection. You understand the mechanisms, and when you understand the mechanisms, you can correct them. That's the difference between management and reversal. Management is pills for life. Reversal is structural repair at the cellular level. Choose where to start based on your own profile. If you regularly consume refined carbs and sugary foods, begin with glycocalyx restoration by stabilizing blood sugar. If you're overweight or show signs of insulin resistance, begin with the insulin reset through time-restricted eating. If you rarely exercise, begin with nitric oxide restoration through isometric training. Don't try to change everything at once. One change firmly established over time is worth infinitely more than 4 changes abandoned after 2 weeks. Hypertension is not a life sentence. These 4 mechanisms create hypertension. Standard medical care addresses none of them effectively. Pills temporarily manipulate pressure without repairing the underlying damage. But you can repair that damage through glycocalyx restoration, decalcification, nitric oxide recovery, and insulin resetting. When you reverse the mechanisms, blood pressure normalizes, not because you're artificially forcing it down with drugs, but because you've repaired your vascular system at a fundamental level. You now have information that most physicians don't have or don't think about. Information that could free you from medication and help you avoid becoming one of the 675,000 people who die every year from hypertension-related complications. Hypertension is not a permanent sentence, it's a reversible condition. If you're willing to understand the mechanisms and do the work to correct them, take care of your vessels. They're the only ones you'll ever have.